Hey, everybody, and welcome back for a Wednesday midweek edition of Lunch Break Live with me, Ivana. And today I am joined by our own Leada Gore. If you watched us week before last, I think it was, Leada came on and gave us an explanation and really broke down all the number of the coronavirus statistics here in Alabama. And y'all seem to really enjoy it. So I brought Leada back. She's going to give us an update on our case numbers and what's going on across the state with COVID. Now, something that we need to note before we get started is that the state, we are up today over 500 cases since yesterday, but the Alabama Department of Public Health numbers showed just on June 7th, so that's just 3 days ago, that Alabama passed the 20,000 case number threshold. We are already over 21,000 now. So Leada's got the information on that. If y'all have questions about your specific area or anything else, please let them know. I'm going to be watching and we will get those answered for you. So Leada, let's just get into what are today's numbers or what are the latest numbers you have from the Department of Public Health?
Sure. Well, if you're familiar with the Department of Health, they had been releasing numbers in live time. So you test positive, supposedly within 24 hours it showed up. They're now only releasing those times at 10 o'clock. We've gone back to what we did in the early days. And we're at 21,626. So we're up 555 from yesterday. Now, if you followed this at all, you would have noticed, last week we were lower. We were like 250, 300, 220, around those numbers. And then we shot up really a lot to over 600. And of course, everybody freaked out, but there was a problem with the data, sort of the pipeline of how the data gets to the health department. They had a vendor problem, just like everybody else with the website has a vendor problem. And so they were trying to figure out how to solve that. So we saw a big increase. We're still seeing an increase. I don't know if all of that is pure data or if we're still seeing a little bit of a lag, but it's fairly obvious. We keep having the same counties with issues, and then we'll see a new one tick up and then sort of level off.
Can you tell us, you say we keep having the same issues with certain counties in Alabama that are rising. Can you tell us about what those kind of problem counties are with these case numbers?
Well, Montgomery is our big issue. And Montgomery is the only county that we have seen. Montgomery now has the second highest number of cases in the state with a population that's not the second highest in the state. It's not the highest per capita, but it's the highest overall. Second overall. Sorry, I apologize for my dog barking. It's what happens when you're working at home, isn't it? But
they know my three have like a signal that like when I go live, it's time to bark. So
mine must have seen a bird or a dog or something. Mm-hmm. But so Montgomery's the second highest, and Montgomery's really one of the places where we've seen what community spread. They're not tracing it to a particular issue. They're tracing it to the fact that the community is having that sort of issue. And their hospital is seeing those issues a lot because we have that hospital serves a large area as opposed to Jefferson County where you've got a lot more hospitals.
Right. And I have some people asking about Franklin County. Now, I know the last time that we talked about, we came here and talked a couple of weeks ago, Franklin County was seeing an issue, and we had an idea of why those cases were going up because of a certain facility. But what's Franklin County look like right now?
Franklin County has maintained that higher than what you would like to see average. It is not out of control. Montgomery is really our only place where health officials are like, we have an issue here right now. But Franklin County is definitely higher. There were some meat processing plants that had some issues. I believe there were some nursing homes that had an issue. That's where we saw those bigger increases. Franklin County, the good news is now that we've got a lot more data to look back on, I can go back and look at some of our older numbers. And let's take Marshall County, for example. You saw Marshall County jump up and then kind of come down, and you would see little spikes and then it would level off. Mobile was a huge issue. In fact, I really thought Mobile was going to end up being sort of our poster child for what not to do. It has not leveled off to where we would like, but it has definitely leveled off. Jefferson County adds a lot of new cases, but there's more people that live there. There's more health care. You still get back to Montgomery. When Montgomery, I forget which day it was, added more than 100 cases, that was very concerning. The other issue that we have seen is Tuscaloosa. Tuscaloosa has jumped up. They are up their numbers are growing, but their hospital can handle it. They have talked a lot about their hospital, because one of the things we don't know, we do know hospitalizations, but it is not comparing apples to apples, because it's a cumulative number. And even if you track the increase, you're not really tracking. It's not a great way to track it. If your community has 20,000 cases of COVID and 19,999 are not requiring the hospital, that's a different situation than if you have large numbers in the hospital. In Montgomery does.
Right.
Higher than what you want. Yeah.
And then so today, as of today, we've got 21,626 total cases of COVID. Now, let's keep in mind, like you had mentioned earlier to me, Leada, that this is a cumulative number. About 12,000 of those people who were included in that 21,000 up count have recovered from the virus. Right. Is that number, that 12,000 number, the recovery number, have you seen that change substantially recently?
It goes up, but again, for the longest time, the health department wouldn't even report recoveries. They don't even like to use the term recovered, because the CDC has not given them, this is the definition of recovered from COVID. These are the following criteria. So that what they have to look at is, are you asymptomatic for a period of time? Well, if I'm at home, my doctor tests, I test positive, I have a very mild case, I'm not sure I report back I'm recovered, but it's almost like an estimate. But yeah, we've seen that number go up. I think when it started, it was 8,000. It's gone up proportionate to the number of cases. The positive part about all this is Alabama's testing has increased. And I looked, I think it was Saturday, that 30-something% of our whole test had been performed in the last 2 weeks. And a lot of that is because I know in Huntsville, they said, even if you're asymptomatic, come on and get tested. They're trying to, I guess supplies have opened up more. The other interesting thing, and this was just a blip on the radar screen, but it was interesting for those of us who've seen it for a while, was that the health department's COVID hotline, I want to say it was like 24 hours a day. Now they've cut it back. So they're not seeing the same number of cases that are just being overwhelming, or I guess a lot of people have had their questions answered. They kind of know so much more about it. There's not as much unknown as there was 2 months ago.
Right. I'm looking through some of our questions. We've gotten a lot of questions about the Baldwin County area and the beaches. Now, I know when the governor's order allowed the beaches to open in May, there were a lot of people who said those counties are going to definitely have a rise in their cases. The beaches are going to cause these numbers to uptick. What have we seen in those South Alabama counties around the beaches? And does it seem like after the beaches being opening that there has been a correlation and a rise?
No. In fact, I kept waiting for Baldwin County. Baldwin County has been one of those sort of low-level tick-ups. I mean, it has gone up. But it's not, I thought when Mobile went up that Baldwin would match it. It would just go from one to the other. It has not to that same level. Now, what's interesting to note is, of course, if I visit the beach and then I come home and I test positive, I'm counted where I test positive, not where I obviously contract the disease. So it would be hard to say, but we have not seen, in fact, Mobile has leveled off. We're at that 2-week point for Memorial Day. We're close to it. So we're starting to see our numbers went up after Memorial Day. And of course, with the recent protest and the crowds and the number of people we've had mixing, especially maybe that weren't mixing before, and out together in large crowds, all the health officials are saying we will see another upswing.
Mm-hmm. And I want to get back to that. But first, I have a really good question from Sandra. And she says, is this more testing possibly due to non-elective surgeries that are being done? Now, we know that non-elective surgeries are allowed right now, but we also know that most hospitals and most healthcare facilities are requiring a COVID test before any sort of procedure. So I think she has a really good point. Do you have anything to add on that?
I do, actually. That's a great question. And yes, it is. It's because when you go in for an elective procedure, you're tested, and so your numbers go up, and you're in a hospital setting, so it's obviously done. Interestingly enough, and again, I'm speaking from North Alabama because that's where I live. I know Huntsville Hospital talked about their percentage of tests of inpatients that come in for elective procedures that test positive for COVID was in the 1% range. So that's good news. That's very good news. Overall, our state positive rate has dropped. I want to say, and I'm doing this math off the top of my head, but it was around 8%, and now it's in the sevens, high sixes. So our number of people, but I mean, if you deliver more tests, that's mathematically what's going to happen.
Right. Now, Alan has a question as well about the 14-day incubation period. That is something that we all heard when the pandemic really got going, especially here in the U.S., that there was this 14-day incubation period for the virus. Is that still standing true? And are we still seeing that 2-week gap in between exposure to test numbers going up?
Yeah. Now, it can be, that is sort of the criteria that they have used in general. Like you said, that's been the general criteria. It is not set in stone. We have, incidents of people testing positive 3 days after, or they start showing symptoms 3 days after being exposed. But that 2-week period seems to be sort of, if you're going to develop it, it's going to be within that 2-week period. So they are still using that, and they're still using that as sort of, are you recovered? Can you, if you're quarantined for 2 weeks, you're asymptomatic, you are quote unquote recovered.
Interesting. And then this, I think, is an interesting comment from Roy here. And I think that this goes to show that the amount of testing has definitely ramped up our numbers for sure, in both directions. But he makes the point about 10,000 cases several weeks ago. Now we're over 20,000. And I think that his question is, are things getting worse? Is the state considering things to get worse, or is testing just more available? And there are, just as we talked about, tests before elective procedures, things like that. How worried, I guess, is the state about things getting worse?
Well, I listened to Dr. Harris, the state health officer, on Friday night. He was on APT speaking, and he has concerns. He constantly brings up Montgomery. Of course, he's in Montgomery, so that kind of makes sense. I think there is the concern is always the unknown. We don't know what's going to happen in the fall. Our numbers, if you look at just a daily tracking as far as 7-day averages, have evened out. Our healthcare system is not overwhelmed. We have ventilators available. Our nursing homes are always going to be an issue. I'm not sure if that will ever return completely to normal. But I would say he is concerned in the same way we are all concerned, in that we don't know the future. And one of the things he mentioned is that how viruses run different courses. They spike, they disappear. Or what it's looking like with COVID, and again, I'm not a doctor, so don't come to me for your medical advice. But if it's not going to be one of these low underlying things we just now have, that's just out there, and you have to protect yourself, but not something that would shut down the economy. But again, I keep hearing people say, well, that was all unnecessary. But there was a report yesterday, and there reports are reports, but there was a report yesterday that shows we prevented 68 million infections by closing down when we did. So let's say even a quarter of those were prevented. That's still a huge number. So, there's always going to be that, but I don't know if we'll ever go back to let's shut everything down. It will just be identify and contact tracing and identifying those hotspots.
Question from Timothy about which county has the most cases, and let's go with overall.
Okay, Mobile. Mobile still has the most cases. Montgomery, you're closing in fast. And I have to look at the recent, because it's going to be, it actually may be Jefferson second. No, it's Montgomery second. Mobile, Jefferson, Mobile, Montgomery, Jefferson would be your list. And you see where that's an issue, because Jefferson's obviously a lot more population.
Now, interesting question again from, I can't tell if this is an I or an L here. I apparently need to put some glasses on, but it's either Kari or Carl, but says that how many patients are hospitalized? Did you have that number from the department, or is that something that they are still not providing? Oh,
no, I can hold on if you let me, and put on my glasses, because some of us aren't as young as Apana. Let's see. Right now we're showing 739 hospitalized. That's up 14 from yesterday. But again, that does not count discharges. It's a cumulative number. So we don't know how many are hospitalized. Dr. Harris said Friday night it was 140 in the Montgomery, I think they have 4 hospitals in the 4 hospitals. So you can see where that issue, but in Huntsville, I believe they said 18 in the whole system. So it's not the same. It's not like if you get this, 10% of you are going to be hospitalized. It doesn't work that way.
That's very interesting that hospital. I didn't realize that total hospitalization rate was cumulative and was not counting those who have been discharged.
It stinks.
That is that is not a great number to lean on, guys.
Yeah. And
question from go ahead.
Let me say this real quick. In the health department's defense, hospitals do not report discharges, so they have no way of. I mean, it's a very loose system of tracking.
Right. A question here from Cody, and I've got other people asking it, but I just saw Cody's first. Ask about Lee County. How's Lee County doing? Now, we know at the beginning of the shutdowns, the beginning of the pandemic really hitting Alabama, Lee County saw in that area of East Alabama really saw a hit there, and Lee County had a lot of hospitalizations, and they had a lot of sick people. So how is Lee County doing now?
Lee County is on the far end of that curve, which is good news for Lee County and Chambers County, both of them. They were our super early hotspots. They saw a lot of deaths in that time, and I don't have the current. I don't know their death total, but their death total was high for that size. But they are down to I'm adding 8 cases a day. I'm adding 10 cases a day. They're not 50 and 60. And for comparison, your Montgomerys are adding 70 and 80 a day. So good news, Lee County. And again, we're seeing the rise, fall, little tick, and then it regulates out. So that's very good news. Now, school starts back. Kids go back, and they bring things from their home, and they bring things from wherever. But at the same time, students, thankfully, we've had no COVID deaths of anyone under age 25 in Alabama. So that's very positive news.
Right. Question here from our colleague, Ian. And he says that, and I think this will be interesting if you can add if anybody from the health department has made a comment on this. But Ian asked, is the difference in overall cases in Birmingham versus Mobile attributable to the mask requirement that is happening here in Birmingham?
We don't know. Birmingham jumped up quicker. Birmingham, obviously, because of population, Jefferson County jumped up quick. Then Mobile, then Montgomery. We've not seen, Jefferson County has gone up and down slightly, but it's been fairly consistent in that 50, 60 cases a day range. They're very equipped to handle it. We've not had issues. And again, because you don't know, unless a hospital releases individual hospitalization rates, you really don't know how they're, unless they come out and say we have a problem, a lot of times you don't know. We have not seen a huge impact related to the mask as compared to other places. That doesn't mean don't wear one. I wear one. But, it's hard to say in any one case, this prevented, XYZ prevented this. I wish.
Right. Right. Just to quickly go through some of your questions. Ginger, yes, that number, that 700-ish number we were talking about, yes, it is classified as COVID hospitalizations, but keep in mind that does not mean that COVID is the only thing those people have. We're not given.
Yeah.
Right. So that just means that they're tested positive for COVID. We don't know if they have other underlying medical conditions or any other health problems they have. So Ginger, yes and no is the answer to your question.
Well,
there.
And let me throw this out there. Along those lines, is 60% of, now this is COVID deaths in Alabama, 60% of all COVID deaths have underlying conditions. Most often
60% of.
Yeah.
Interesting. 60% of COVID deaths have underlying conditions. What is our death rate right now?
No, wait. You know what? It actually is higher. I am wrong about that. That's 60% have multiple underlying conditions. Our 95% of our deaths have underlying conditions. 5% do not. I don't know the latest mortality rate. I want to say it was around 3%.
That's what somebody had said in the comments there. So around that 3% is right. Now, this is kind of something we were talking about a minute ago, Leada, but I thought it was interesting to recap. Sharon asks, how can you accurately track and compare testing versus cases when the reporting has been going up and down through ADPH?
Preach it, sister. I say that every day in my life. You can't. The health, I mean, you do the best you can, but the health department came out this week. There was, the big delay, and we didn't have all the data, and da 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 da. Listen, I am not blasting the health department. I have seen these people; they are working around the clock. Nobody's dealt with this before, and I gotcha. But I think you look at the 7-day averages, you look at trends, and not necessarily today this happened, because there's going to be difference in cases. And, we've dropped cases in certain counties because you realize, oh, they live in a different county and you're listed in the county where you live. So you can't really say, oh, we're up 3 today, I can go to the grocery store. It doesn't work like that. You have to look at your community over time. And luckily, most of our communities, you see things that pop up, but most of our communities are in good shape as long as people keep, common sense measures in place.
Right. Now, let's talk quickly about Morgan County. I know we've seen a spike in Morgan County.
Yep.
Can you tell us those numbers and any indication as to why that's happening?
Well, Morgan County was super low, and then we saw a big increase over time. Again, you've got some plants there that have issues. It's the same we see everywhere. You get plants, you get a nursing home, you get those sort of things. I don't have their numbers right in front of me right now, but I know that they are one of those sort of budding hotspots that we've watched over. Hopefully they caught it early enough that you've got to isolate and you have to identify who those are. Now, it may be a lot like Marshall County, where we saw large numbers, but 99% were asymptomatic. So that would be good news because their hospital's in really good shape.
Right. Looking again through some of y'all's questions, Carrie, I'm so sorry, says that she knows a woman who got it very badly. We hope that your friend is doing better, and we're sorry that happened to her. Now we are getting some other questions too about the humidity in Alabama, the heat in Alabama. We've heard a lot of back and forth over whether that could either increase or decrease things. One thing that we do know is that it is harder to be in an outdoor area and to gather. If you're going to gather outside, eat outside, do things that we know that the CDC and other places have recommended, because it's probably a lot easier up north where it's not quite as hot. So we might see more people go inside and have those gatherings indoors in places like Alabama. Has the health department said anything about indoor gatherings, indoor eating, things like that? And do they believe that could affect the case numbers?
Yeah, we're still in our same, recommendations, stay 6 feet apart. They've never really come out and said, be outdoors, you're okay. Their whole thing is 6 feet apart, be 6 feet apart. I think the thing in that I have seen, that question probably was written by me, because I am struggling wearing a mask in the heat, in the humidity. It's hard when you're outside to put on a mask because it is so hot and you feel like you can't breathe. So I think over time you're going to see that. I mean, that heat plays a role. Now, it may play a role in lessening, and Dr. Harris talked about that Friday, where the flu goes down in the summer. We see that happen. It still exists, but it goes down, and we may see the same thing with COVID. We're not really seeing that right now. The numbers are still there, but again, as long as your hospital's not overwhelmed, you got vents, you got supplies, it doesn't seem to be quite as critical as it was 2 months ago when we didn't know as much as we know now.
Right. And getting some more questions about the vaccine. I don't think that we can add anything about the vaccine science-wise. Wish we could. And hopefully maybe we can bring you a doctor on here soon to explain a little bit more about treatment and vaccines. Now, I think that as well, I have one other question I wanted to get to. But first, Joe Elaine asks, and something that we had talked about earlier, Leada, I know you're a mom. And she says, is there any concern for students going to school and maybe contracting the virus and bringing it home and spreading it to their families? And do we expect numbers to go up if and when kids go back to school?
Yeah, that is the great unknown, and that is everyone's concern, because kids, we do have issues of children contracting it. They seem to do very well with it. I know many of my educator friends, and working with my daughter's own school, they're working on their plans. They're putting their plans in place. That is the great unknown. Now, Dr. Fauci early on said, kids go back to school. We're going to go back to school. You notice, though, he didn't say what date we were going back to school. That's always going to be the concern. And we also have concern about educators. We have educators who are going to be exposed. a friend of mine who teaches at a large high school said that's 200 kids a day. Or a librarian I talked to yesterday said, I'm touching thousands of books. Now we know contact, is probably, but still you're around that many kids. That is the great unknown, but at a time, I think we're going to have to jump off that cliff and take the risk and then just see what we can do to mitigate it as we go.
And we'll end on this question here. Several people asked it. I'm just putting Timothy's on screen, but everybody wants to know if within the last week or so, these large protests that we've seen across the state, I know you're in Huntsville, I'm in Birmingham, both of our cities have seen those, and other cities across the state as well have seen very large protests. And in Birmingham, a lot of these protesters have been wearing masks because that is the ordinance here. But outside of the city limits, that is not the case. And a lot of people who are in these big crowds have not been wearing masks. So has the health department said anything about expectations if numbers will go up due to the protests in the past week or so?
Their comment was they were cautiously concerned. I don't see how there is a way there could not be some increase related to this, simply because we have large crowds together. And Dr. Harris pointed out you're yelling, you're expressing yourself, and so you're up close to somebody. That's water droplets coming out of your mouth. And I think the thing about the large crowds is you've always got an issue with a large crowd to get the flu, whatever you're going to get. But this does seem to transmit very easily in that sort of setting. But the thing that kind of concerns me more than anything is the inability to trace. Let's say I am at a protest and I start feeling bad and I test positive. The ability to contact trace those around me is impossible. Because what do I say? Well, I was at a protest. Okay, so there are some states that are telling people if you're at a protest, you need to get tested. Because you cannot say, well, here's a list of everyone I was around at this protest and that could potentially be exposed. That is really the concern on the protest is if one person has it and spreads it, there's no way of telling who they spread it to. So they're saying cautiously concerned. I think everybody's cautiously concerned about the protest in the sense from a public health standpoint. Good news is they are outside. That is we think a little bit of a positive, but I would certainly encourage anybody who went to one to wear a mask and consider getting tested, especially if you have the slightest symptom, please stay home. That's the main thing.
Right.
If you are sick, stay home and don't protest. Protest.
Right.
Great. Yeah. Yeah. I think that's the main
I'm going to spitfire, rapid fire, answer some of your questions. Susan,
Okay.
Can we have an immunologist, from UAB come on? Yes, Susan, I will do that. I will make a call today and work that out. We'll have one back. Latasha says she has cancer and worries about it. Latasha, we're thinking about you. We hope you get better, and we hope everything goes well for you.
Yeah, stay home.
And yes, hang on, keep fighting, Latasha. You've got this. Questions as well about some more about testing and the numbers that they want to see. Leada will have that for you later on today. Yep. We will put it here in the links so you can read it. You can see your county and you can see the increase in your county as well. So I will put that in the links here so you can see it and you can actually get a visual and compare the counties across the state. So we thank y'all so much for giving us all your questions and for hanging out with me and Leada today. And Leada, we thank you so much for all your knowledge and for sharing it with all of us.
Thank you.
And for everybody else, we will see you tomorrow, and I will work on getting that immunologist for you. So y'all have a great day, and we'll see you later.